All right, today we're going to pull back the curtain on a pretty common surgery, the abdominal myomectomy. We're going to walk you through the whole thing, from start to finish. Think of it as a visual guide. So let's jump right in. You know, the word surgery can sound, well, pretty intimidating, right? But what if you knew exactly what was happening? We're going to give you that inside look, breaking it all down step by step. It really does make a world of difference.
Okay, so before we can really get into the surgery itself, we've got to understand the why. What's the problem we're trying to solve? And that brings us to uterine fibroids.
So a uterine fibroid, sometimes called a myoma, is basically a benign growth. It's not cancerous. It's made of muscle tissue from the uterus, and here's the thing, they're super common. A lot of people have them and don't even know it. But for others, well, they can really cause some serious problems and affect daily life.
Now, where a fibroid decides to set up shop is a really big deal. It's not just about how big it gets. You got these different types. Some grow on the outside, some are tucked deep inside the wall, and others bulge into the uterine cavity itself. And that location, it's the key to why symptoms can be so wildly different for everyone.
So, what's the end game? Why go through surgery to get these things out? It really all comes down to quality of life. We're talking about things like heavy bleeding, constant pain, or that feeling of pressure all the time. A myomectomy is all about getting rid of the source of those problems.
All right, now for the main event. Let's head into the operating room and see how this all goes down, from the very first cut to the last stitch.
You can think of the whole surgery in 5 basic phases. First, you've got to get in there. That's access. Then you prep the area to make things safer. Removal is, well, that's the obvious part. After that comes the really crucial repair phase. And finally, closure. Simple as that. Let's take a closer look.
Okay, step 1, getting in. The whole thing starts with an incision. Usually surgeons make what's called a low transverse incision. You've probably heard it called a bikini line cut. It goes through the skin and the layers underneath to get access to the abdomen.
All right, so we're in. What's next? Preparation. This part is super important. A special medication gets injected right around the fibroid. What does it do? It basically tightens up the blood vessels, and that's a huge deal because it helps keep bleeding to a minimum during the next step.
And here we go, the heart of the operation, taking that fibroid out. The surgeon makes a cut right on the uterus over the fibroid. Then, it's this really careful process of separating the fibroid from all the healthy muscle tissue around it, and then it's lifted out. You might think taking the fibroid out is the whole job, but nope, the repair is just as important, if not more so. The surgeon has to sew up that opening in the uterus, and they do it in multiple layers to make sure it's super strong. This isn't just about healing now, it's about making sure the uterus is healthy and strong for the future, especially for anyone thinking about pregnancy down the line.
And finally, we close up shop. Once the uterus is all repaired, the surgeon stitches everything back together layer by layer right up to the skin. And just like that, the surgery itself is done.
So, the surgery is over. But that's not the end of the story, right? Now comes the road back. Let's talk about what healing looks like and what you can expect during recovery. Recovery isn't a single event. It happens in stages. You're usually looking at a day or 2 in the hospital, just for observation. Then, those first couple of weeks at home, it's all about rest. Seriously, no heavy lifting. It generally takes about 4 to 6 weeks before you're back to feeling like your old self and doing all your normal activities. Now, we have to talk about risks. With any surgery, there are things to be aware of. We're talking about possibilities like extra bleeding, infection, or internal scar tissue. They call that adhesions. And it's also really important to have a conversation with your doctor about how that scar on the uterus might play a role in any future pregnancies. Look, these things aren't common, but it's always good to be informed.
Okay, so we've been through the whole procedure, the recovery. Let's zoom back out. What's the ultimate goal here? Why do it? It really boils down to 2 huge things: getting the uterus healthy again and keeping future options on the table.
It's kind of like a tale of 2 uteri, right? Before, you have these fibroids that can really mess with the uterus's shape and how it works. But after the myomectomy, the whole idea is to get it back to its normal, healthy state. No more disruptive symptoms, and crucially, preserving that potential for a future pregnancy. So if there's one thing to really take away from all this, it's that a myomectomy is a pretty amazing targeted solution. It's not just about yanking out a problem. It's about preserving an incredibly important organ and giving someone their quality of life back. And that leaves us with one last question to chew on. How does really understanding a medical procedure like this change how we feel about it? I think when we pull back the curtain and see what's really going on, we swap out that fear and anxiety for knowledge. And that knowledge, it's empowering. It lets us be active participants in our own health.